Welcome, everyone. Thank you for joining us. My name is Julie Cullen, and I'm the managing editor of American Nurse Journal, the official journal of the American Nurses Association. Healthcare leaders have been warning for years that U.S. hospitals face a growing nursing shortage. One widely cited study projects a shortfall of 510,394 registered nurses by 2030. The main reasons are varied, but some groups, such as the ANA, point to waves of retiring baby boomer nurses, an aging population requiring more medical care, faculty shortages that limit the capacity of nursing schools to accept more students, and more nurses moving away from direct patient care or leaving healthcare altogether because of stress or burnout. This perfect storm of causes is felt acutely by those charged with the daunting task of nurse staffing and retention. Today, we've convened a panel of nurse leaders and industry experts for this video series to share their recent frontline experiences. We'll explore the best practices they've followed and the creativity and problem solving they've brought to the workforce shortfall. We'll also discuss the technology tools that have empowered them to devise staffing strategies that improve healthcare working conditions while ensuring patient care and mitigating fiscal impacts. Our panelists today are Danielle Bowie, Allison Bruckner, and Brian Dickerson. So let's go ahead and get started, panel. And I want to start with the first question today. This past year has seen some unprecedented developments and distressors in the U.S. healthcare system at large, and the nursing community in particular. What have each of you been experiencing in your own organizations during this new nursing normal?
Danny Bowie here. Pleasure to be here. And I currently work for Bon Secours Mercy Health. So what we've been experiencing over the last probably 18 months or so, I think it's been in alignment and very consistent with a new report that was published by the NSI, the 2021 National Healthcare Retention and RN Staffing Report, is that we are experiencing a bullish market, right? We have a demand for nursing, and then we're feeling increased staffing pressures related to that increased need. And we're also starting to see some trends in regards to increase in turnover and vacancy. So as you mentioned before, this perfect storm that we're experiencing is a demand for nursing, but also the nursing workforce is reacting to what's going on. And we're seeing some vacancy or turnover in different areas within our health system. And that's created some pressure and also caused the nursing leadership to pause and say, how can we be reactive as well as strategic to the immediate need? And so we've just been evaluating what's been happening across our geographies. And then we're adapting targeted strategies to help strengthen our nursing workforce. We really, really, really want to create a healthy, supportive work environment based off of the trends of turnover and vacancy, and also looking at some creative strategies regarding staffing and scheduling and flexible workforce, in addition to compensation. So we have a multi-pronged approach based off of what our markets are experiencing, but turnover and vacancy is a big pressure point for us right now in different markets and based off of state metrics as well. But excited for what the future holds. Just because the pressure's coming doesn't mean that we can't get creative and really take the challenge head on.
Brian, is there anything you'd like to add to that?
Yeah, I would like to add a few things. I think Danielle hit the nail on the head, but I think I'm seeing a lot of organizations where they're so short-staffed that even nursing leadership is getting pulled into direct care, and in those situations, you're seeing them having a very difficult time to innovate and figure out how to do things differently so they can impact change, because there's just so much work and it's just being focused on that bedside care. So that's making things very challenging because it's you have to innovate, you have to evolve to work your way through it. But if you can't because you're so busy at the bedside, it's really a challenge.
I'm Allison Bruckner from Mercy One in Iowa. And for us, really, the biggest challenge has been decrease in the nursing workforce. So decrease of registered nurses. We've also seen an increase in travelers and agency workers that we've had to add into the fold. And then that has increased the workload on the nurses. We've really seen a shift and a decrease in ancillary services also. So EVS workers, dietary, nutrition, transport services. So all of those extra tasks the nurses have had to take on, which has increased their workload. And that's been the most difficult part of this.
What do you think has been the most acute or unusual nurse research challenge? I'd like to hear from each of you on this. So again, it's the most acute or unusual nurse research challenge that you've faced in the past few months.
For us, that's really been nursing turnover and nursing burnout. Because of that workload and the extra work that's been put on the nurses, we've seen a shift in newer nurses leaving the bedside to do other work. We've also seen a lack of the new graduate nurses being ready to practice. So they have not come to us with clinical experiences and things like that. So really a decrease in the experience that we have at the bedside.
It's not just nurses, it's across the board, the shortage of labor. And unfortunately, the things that aren't getting done that typically were done by CNAs, techs, and others now are having to be done by the nurses. So on top of the high load, and I would also add more acute patients, they're having to pick up and do more. So it's really, as Danielle said, the perfect storm here in staffing. I've seen situations where not having sitters causes a problem, to the point that one of our clients got very innovative and used one sitter to cover 4 patients in 2-hour blocks, where the CNA would have to cover them. So they'd move the sitter every 2 hours to a different unit, just so to give the CNA a little time to do some of that other work that needed to get done, so it didn't fall on the RNs. So organizations are getting very creative, but it's, every day they got to pull the new rabbit out of the hat.
I would agree with Brian and Allison. What we're experiencing is requiring creativity to a whole new degree. Need is the mother of invention, right? So based off the need, new things are happening within the industry. I think one thing that I'm also seeing, because of a rise at a national level with turnover, a rise at a national level with vacancy, we're also seeing the agency or the contract labor market boom in a way that I've never experienced in my practice time as a nurse, where we're seeing increased rates for agency spend. We're also seeing that part of our workforce is very attracted to what agency is offering, new experiences, higher compensation, etc. And this new wave of agency workforce and spend has sustained farther than any of us ever anticipated with what was happening with COVID. And so because of this, we've had to really evaluate at a ministry level for BSMH, how do we want to be competitive in this space to continue to engage our workforce, to give them diverse experiences, great compensation, and really we do rely on agency. I think that's part of a workforce strategy for any health system. That's not the only way we want to build our workforce strategy. And so we've been working creatively to develop new models and new programs for our nurses to join to help create that diverse experience within their market and within hospitals, so that we don't lose them to agency if that was a factor before. So that's one area that I haven't felt that pressure before. And to Brian's point too, you're right. There's a lot of nurse leaders working the floor right now to help meet that need. And so the dedication at Bon Secours Mercy Health is I have a team dedicated to nursing workforce initiatives and strategy. And so our goal is to say we've got to liberate those nurse managers, get them out of the bedside so that they've got the strategy and the tools to do the job right. So we're looking at different pipeline supplies, different technology they can use to really enhance their work and get them practicing at the top of their licensure. But it's a journey and it's a marathon. This definitely is not a sprint by any means.
Danny, I want to throw this one to you. So, some states have elected to suspend regulations governing nurse staffing and scheduling at hospitals to provide greater flexibility under the recent shortages. What impact have these government waivers had on the nurse staffing situation?
I think that that's a wonderful approach right now for our health systems and hospitals. The current environment and the condition that we've been experiencing and we've all been speaking to, which was increased turnover, increased vacancy, trying to improve retention, those require targeted approaches from our nurse leaders. And so being able to allow our nurse leaders to focus on the issues at hand and not have to do the extra work often associated with any type of staffing law that usually is in place for states. So usually that requires administrative reporting and often additional work. And as we've heard in this time together, that our nurse leaders are really working really, really hard to meet the needs of patients and get staffing right. And so to add an extra layer of work that may not have value add, but is more regulatory, just isn't appropriate in this time. So I think it's a great approach. And then we can evaluate, where they need to go in the future. But right now, it's what we need. We need that flexibility and opportunity to address the issues at hand.
Can each of you give one example of how you successfully navigated a critical staffing encounter in your organization in these recent turbulent days? Allison?
One way here at Mercy One that we've had to combat this shortage is really to focus on our PCTs, our patient care techs, certified nursing assistants, and as the nurses ratios have increased slightly, we've been able to train new techs at the bedside and give them a one-to-one nurse to tech teamwork relationship to take care of those patients together, and really adding resources that we didn't have before.
From the technology side, we've looked at a lot of different things, but one of them, in partnership with one of our clients, was to look at how can they model their staffing based upon their predicted patient volumes, and look at how they can stretch the organization as a whole by simply looking at running their HPPD hours up a little bit, or just looking at different levels of staffing, so they can see, where do we need to run? How can we stretch a little bit across the board to gain a little extra capacity based upon what the expected volume is? And that's been very successful. Obviously, it's asking the RNs to step up and take a few more patients, but it's doing it fairly and equitably across the board.
There's no perfect time to take on staffing and scheduling, right? There's always some type of an environmental factor going on that we need to consider. So over the last year, so of 2020, Bon Secours Mercy Health, the nursing workforce team in particular, we committed to redesigning staffing, scheduling, and timekeeping. So we just completed a massive redesign for our whole health system, which COVID highlighted the need for this redesign. The redesign was inclusive of bringing in what we call resource optimization centers. And these centers were set up at the market level, and a market can have 2 hospitals, 5 hospitals. So we have 10 markets in our health system that operate in 7 different states. And so we set up resource optimization centers where we centralize staffing, scheduling, and timekeeping. And we have new roles doing the work. We have new policies governing how we operate. And we have new technology that we're pressing into to ensure that we're doing the work smarter, not harder. This is a new initiative for our health system. And so overall, over the last year, we've implemented 11 ROCs, is what we call them, that are supporting 34 hospitals and about 14,000 employees. So it's been a big change, but we're creating a foundation to see our staffing and scheduling more at a system level, to understand our workforce and how we can deploy them in a more equitable and fair manner, and also incentivize our shifts in a new way and fairly, so that we're spending the right amount and we're getting the right nurse to the right assignment at the right time. That's always our goal here. So we've got a whole new team doing this work, and we've got really dedicated nurse leaders involved in the process. And it's been fantastic, and it's also been very involved and kind of mind bending a little bit in how we're trying to approach the way that we do our work today. And ultimately, our goal was to elevate the work of our nurses so they were practicing to the top of their license. We didn't want nurses creating schedules. We wanted to have a support team to create schedules and support staffing efforts across our health system. So we're just in the beginning phases now of optimization and stabilizing this new initiative, but really excited. And we think that this is something that's going to be the best in the nation and really set us apart as we look at other health systems and how we're operating to support our nursing resource work.
So I want to ask each of you this next question. In the face of all the other difficulties, it's still necessary to gauge and manage the fiscal impact of this perfect storm of events. We keep going back to that perfect storm analogy. What tools and systems are each of you harnessing to address the financial aspects of this particularly stressed staffing environment?
Yeah, that's a great question. As I've mentioned before, so we've created an ecosystem of managing our resources. And that ecosystem also involves technology and the integration of technology. So staffing and scheduling technology, our finance technology, HR technology, it's all working together to give us a view of what's happening. Also, as I mentioned, garbage in, garbage out. So we really, as an organization, cleaned up what we were entering into these systems so that now we have a clear picture of what's happening with our financial spend. And, we want to get to the place of proactive or looking into the future for where our spend is heading. And I believe that's where our resource optimization centers for Bon Secours Mercy Health will take us. But we have both approaches. We look at the retrospective spend and what that was, the last pay period or so. And then we also have our resource optimization center teams that now have the tools to start to look ahead and think proactively about staffing and scheduling to ensure we're spending the right amount on the resources without compromising patient care or quality, and also ensuring that we have the right nurse at the right place at the right time to do the job. So it's all working together, and we're becoming more sophisticated in this space. And we're excited to grow in the more proactive approach as we move forward.
I think at some of our clients that are using the most of our infrastructure, it's a combination of patient movement, discharge management, and staffing. The one thing that you really need to focus on, if a patient hasn't been discharged when they should have been, and that means your staff is having to care for somebody that technically should be gone. Another patient could be in that room. I mean, it's not like there's going to be an empty room for very long with the volume of patients, but getting the patients moved. So making sure that you're thinking through not just staffing, but what your patient flow needs, making sure that your discharge priorities are put in place and that information is gathered about what are the needs to get those discharges done and making sure they happen and making sure everybody's on the same page as far as a plan. So I think it's around transparency, but it's transparency at a much bigger picture. It's staffing and moving patients as efficiently as possible.
I would echo what Brian says. For us, it's really about the patient flow planner and making sure we're doing our care team rounds daily on every floor, and everybody uses that patient flow planner to communicate what our barriers to discharge are, because really keeping our length of stay at the GMLOS is the most important. Also, we are very proactive at getting discharges out before 11 a.m. So being able to look at that the evening before, plan what discharges are leaving early and get them discharged so that we can pull, instead of having to push against the ED admits in those holds, we can pull them into the acute care space, give them the care they need, and then get them transition to the next level of care. That's very important for the financial aspect, and volume. Obviously, volume fixes everything in the way of finances. So the more patients we can get through the system, the better. But also, how do we do that well? We also use the productivity tool within Hospital IQ. So as we were talking earlier, and adding resources, maybe that's adding techs to the nurses, because the nurses have different ratios. We still want to make sure that we're not overloading the system or using too much in the wrong places.
Thank you, all of you, for your time today and for sharing your insights. We hope that this exchange has provided some pragmatic, actionable steps in these extraordinary times as we strive to optimally staff to best serve patients. Thank you, everyone, for joining us today.